The people will fight on forever and ever and ever.
Activists numbering about 1,500 are meeting in plenaries, in sub-plenaries, and in workshops, discussing what are the factors that today deprive people of the right to health, in spite of tremendous progress that has taken place in knowledge, in resources that can address issues of ill health. They will also be strategizing about actions in different regions and in different countries, where the People's Health Movement will be in the forefront of trying to counter global, regional and national forces that prevent people from leading healthy lives.
I work to a HIV and AIDS organization, and I expect that here in the Assembly would be possible to connect many struggles from many countries to try to find a connection to build a global struggle against lack of access to medicines and health.
We are in a serious health crisis, and that cannot be argued. As you have seen, the issue that are affecting lots of people, we've got lots of governments cutting out on budget, what they're calling austerity measures.
I came here to this assembly to address the issue of incubation, as Palestine is under incubation since a prolonged time. Incubation and the practices and policies of the Israeli incubation considered the first and the most important factor that affect our health situation in Palestine.
This conference means renewal of the idea of the right to health and how to bring it into practice. And moreover, it's an excellent opportunity to meet new people and to meet old friends with which I have been working all over the world.
I am at the PHA in Bangladesh because I believe everyone has a right to health, and it's our responsibility to make sure that everyone has access to quality, affordable health care.